Hello, good evening. We'll just wait a few moments for a few more people to join us. You're in the right place. This is Care Fertility's virtual event. Just give people a few minutes to arrive. I could tell you about my day. I've been, I'll introduce myself first, but I'll wait just a few more minutes. That's all right. Just waiting for a few more arrivals. Good evening, everybody, as you're joining. Very welcome. So I'll start by introducing myself. So I'm Alison Campbell. I'm Care Fertility's Chief Scientific Officer. You're in the right place. We're just waiting for a few people to arrive. And so warm welcome to everybody joining this evening. It's our virtual event. I'm Alison Campbell from Care Fertility. I've worked with the group for 25 years this year, so part of the furniture. And I've yesterday I was in Manchester in our lovely clinic there, and today I've been down in Bath. Great clinic, beautiful Gloucestershire. Is it Gloucestershire or Somerset? In the countryside, beautiful place. So that's where I'm near there now, just at my in-laws' house. So lots of travelling for me this week. But so just to get us started, so this is the virtual information evening called Paths to Parenthood. So I'm Care Fertility's Chief Scientific Officer, and I'm going to be hosting the event this evening. So just to let you know what you can expect, it should last around 40 minutes or so. We've got 3 short information videos all about Care Fertility and our team. And I'm going to walk you through the IVF pathway, right from consultation to embryo transfer. We've got lots of diagrams and videos, which I try and negotiate to pop up at the right time so I can inform you as best as possible. And we're going to intersperse this presentation with 2 question and answer sessions with myself and Professor Charles Kingsland. So you can ask questions in the private questions tab or in the public chat section. If you use the public chat, then everybody can see your first name. But you can also send questions if you prefer by email to events@carefertility.com. If we can't answer your question this evening, then we will reply by email later on or tomorrow. And we've got some staff behind the scenes. They're fielding the questions and they're there as well to support you. So you can email anytime, events@carefertility.com. And I'm very pleased to say as well that we've got our new patient inquiry team available on the phone this evening, and their number is 0800 564 2270. So we're going to get started now with a short video introducing you to Care Fertility. So I'll just share this with you. 1 second.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex. We get single patients wanting to start a family. We get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us. So we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic. And even when I was ringing out with, I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way. And I feel like they lived the journey with us.
So I've had several treatments with Care. I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Sorry, unmute the microphone. So I'm going to walk you through a presentation now and take about 10 minutes before we bring in Professor Charles Kingsland to answer some of your questions. So as we just heard from him there, we believe family is for everyone, and we help lots of different types of patients with a large selection of treatment options depending on your situation. And so during this event, we're going to mostly focus on the general IVF process. But whether you have treatment with your own eggs and sperm or with the help of a donor, the principles are the same. I'm going to move on to the map. Here we go, a new map. So we've got another clinic recently in Leeds. So these are the locations of our clinics across the UK. And with this arrangement, our patients get the benefit and the knowledge pooled from a huge group of fertility professionals within a local friendly clinic facility. So we have around 150 scientists, up to 50 medical doctors, all with their own specialisms and expertise. So we think it's really important that we work together and we pool our resources and experiences to give patients their own specific customized treatments. So it's really easy to get started with Care. This is Shah, and we're going to hear from her a little bit later on. And we have a new patient inquiry team, and they're really friendly and knowledgeable. I'm available to answer all your questions about treatment and about getting started. And members of that team are available this evening. I gave the number earlier. I can give it again when I remember it. So the team leader, Lauren, she's there, I think, this evening on the phones as well. Chloe's there. So they'll be able to help if anyone's got any particular questions, and they're going to be fielding the cute questions as you type them into the Q&A box or the chat box. So we move on to the process of the treatment right from the beginning. So getting the right diagnosis and gathering information from you is key so that we can give you the best advice. And this is Alex in our London laboratory. So you can see her there looking down the microscope with her colleagues in the background. So when we've got all this information from you about where you're up to actually with your fertility journey, the efforts that you've made to date, you can post that information onto our patient portal. So we can register you on the system where we've got all the information there. Some people have loads and some people have very little or next to no information when they start out. But once it's there, we've got everything in the right place, and that really helps us to manage your treatment best. So this is just a slide to show how the portal looks, and that we've got this patient portal. So all the test results are uploaded there, and all this information then before your consultation can be reviewed by one of our consultants. And here is Dr. George in our Sheffield clinic. He's one of the consultants there. So in your initial consultation, your fertility specialist is going to do several things. Really important to go through the process, to listen to your fertility plans and wishes. Everybody has different expectations and different experiences so far. So we'll take time. I'm not still muted, am I? No. We'll take time to listen and go through the existing test results. We'll explain any further tests that may be beneficial to help us understand your situation and then program your treatment or talk to you about your options. We'll discuss the different treatment options that may be available to you and the chance of success of each of those options. So the intention from our consultation is that you'll go away from this with the detailed information about your options, so you can consider them in your own time. You'll know how and where to get support from us in the meantime from our team, and you'll understand the costs of any treatment that you may have been discussing. So whether your diagnosis is really simple or complex, we've got that depth of experience that will give you your best chance of starting or growing your family. And after your consultation, our clinic teams are available if you've got any follow-up questions, and they can send out any further information that you may need through to our patient portal. Right, so starting a course of treatment. So we're going to talk mostly about the IVF process. And everyone's treatment's different, and we pride ourselves in individualizing treatments. And they can start really quite simple with intrauterine insemination, where the sperm is prepared and put into the uterus, the womb, and they progress to really technologically advanced and complex treatments, which we'll cover a little bit later on. So I'm just going to spend a few minutes walking you through the key stages of an IVF treatment cycle. And most care patients need IVF, and much of this, what I'll talk you through, will apply to many of the other treatments that we offer. So here we have Di Baranowski, very wonderful nurse, one of our team, and she's here just showing us how we start the first stage of the process, which is ovarian stimulation. It's the first important stage where we prescribe medication to stimulate the ovaries so that they develop follicles from which we can collect the eggs. So everyone is issued with a medication protocol, and one of our expert nurses will explain to you, along with how to administer the medication by a series of injections. We also offer online injection teachers, so if it's more convenient not to come into the clinic and have a face-to-face training session with the injections, we can do that online. And the next stage is monitoring, and this is Rima, the medical director in our Birmingham clinic. So we monitor the developing follicles. So you've had your protocol, you've got your medications, you know how to do your injections, and you'll be delivering yourself these injections for a few days until we ask you to come in and have an ultrasound scan. So these images here are just showing how the ultrasound scan takes place. It's usually between 3 to 7 days of monitoring in total. So you have your stimulation, and then we'll ask you to come in a couple of times to look at how the ovaries are how the follicles are developing on the ovaries. So it's very patient dependent. And when we're happy with the number and the size of the follicles that we've monitored and measured developing on the ovary, then we'll give you a final trigger injection. And this will help with the maturation of the eggs to get them ripe, so to speak, for the egg collection, which is around 36 hours after this special trigger injection. So the egg collection, it's a fairly straightforward procedure, and we use ultrasound again to guide a needle to the follicles on the ovaries, and we carefully extract the eggs from, they're sitting on the surface of the ovary in fluid-filled follicle. And it takes about 20 minutes or so on average to aspirate the fluid on these follicles, and this fluid goes through to the laboratory where one of my colleagues there will be able to look down the microscope and detect and find the eggs, keep them in the incubator. After the egg collection, we'll just ask you to rest for a few minutes or so until you're ready, and then you can go home same day. If you're using donor eggs, then we can usually thaw them around the time that the sperm is being produced. Oh, I've got a video here, very exciting. So we'll have a look at sperm swimming. One moment, please. Just get the right one. Sperm, here we go. Choose this media. There we are. I saw an embryologist today who she's recently trained in semen analysis, and she said when she closes her eyes, she sees these little sperm swimming around like this. So the sperm sample is generally prepared around the time of the egg collection, and we're currently offering either to produce the sperm sample on site or to bring it in from home. And if it's frozen sperm, then we'll already have it in the clinic, so we're preparing that at the same time. So whether the sperm is surgically recovered, whether it's produced on site, or whether it's thawed, we prepare it in a very similar way. We wash it. I'll just minimize that. I'm not good at driving today. Too many clicks. I'll close. That's it. Remove that. Okay, we'll go back to the slides. Aha, this is good. All right. So we prepare the sperm, and then the very important fertilization stage. So with the fertilization, it's where we mix the eggs and sperm, and we can do this in one of two ways. IVF, which stands for in vitro fertilization, it's conventional IVF. We mix the eggs and sperm together after we've prepared them. They've both been washed. We've diluted the sperm to the right concentration, and we put them together. And the other method of mixing the eggs and sperm insemination is ICSI, Intracytoplasmic sperm injection. I have a video. I'll show you because it's very special to see this as well. ICSI. Okay, so with this one, you can see in the pipette on the right of your screen, tiny dot, that's the sperm. The big circle is the egg in the middle. It's being held by the pipette on the left of your screen with a little bit of suction. You can see now the sperm is just being released into the egg very gently. So that needle that we just put into the egg there is 10 times finer than a human hair. Really fine, fine needle. And we use micro manipulators to control the aspiration when we're taking the sperm up the pipette and then putting it into the egg very gently. So we've done the fertilization, so we've added the eggs and sperm in either by mixing them together because the sperm numbers allow that, or by putting a single sperm into the middle of each egg. So we decide the final decision on the method of insemination, whether we use IVF or ICSI, would be taken on the day of egg collection. But almost always we know in advance what treatment is going to be right for you, and that will depend on the semen analysis and the consultation and the decisions made beforehand. So here we have Lena from our Nottingham team. She is here looking down the microscope assessing those eggs that we'd inseminated the previous day for fertilization. And the sign of fertilization is a wonderful sight. It's two little nuclei in the egg. One is from the egg and one is from the sperm, and that's what we're looking for. And that's one of the most, I would say, one of the most magical parts of our jobs as embryologists, is looking to confirm fertilization. So once we've seen fertilization, on the day after the egg collection, we'll contact you and let you know how that's gone and give you information on the next steps. So following that fertilization, and this is Alex here from our London team. So following that, the embryos are left mostly undisturbed for several days in specialized culture medium, like a solution. And those dishes that the embryos that are developing are sitting in are electronically tagged, RFID, electronically and uniquely identified. So we aim to perform embryo transfer at the blastocyst stage. So we'll keep the embryos following fertilization for between 4 to 6 days usually, and then we'll be able to choose the best one. We transfer usually a single embryo, or else we freeze them, because sometimes it's better to freeze before we transfer. So all of these things, important decisions, are discussed with you in detail as we walk you through the process of your own treatment. So I'm briefly going to talk about 2 ways in which I think care really excels in the laboratories, and how we select embryos. It's very important. Most patients, because of that stimulation that we've talked about, that causes the ovaries to produce more than one egg, because of that process, we tend to get more than one embryo for each patient. That's the reason we're stimulating the ovaries, to increase the chances of getting a good number of eggs, to get good fertilization, and then to be able to choose the best embryo for transfer to give the best chance. So Care Maps is something very unique to Care. It's a product of a decade of research and development, and we use time-lapse imaging to monitor, and we've monitored tens of thousands of embryos so far, but we're monitoring these embryos through the whole time that they're in our care, in our laboratories, in a non-invasive way, taking photographic images through multiple focal planes every 5 or 10 minutes. So we've compared the patterns of development from embryos that have been successful and resulted in a baby with those that have not. And we found significant differences, quite subtle differences, but significant differences that we can detect for patients using this technology. And that has allowed us to develop algorithms, which we call Care Maps, to successfully choose the best embryo first time. So it's not going to change the embryos, but it's going to help us, because most embryos look quite similar. It helps us choose the best one based on those developmental patterns that we've been recording during this time-lapse monitoring. The other technique that we can use, which is we're very specialized at, we're very experienced at, is called PGTA. Stands for Pre-Implantation Genetic Testing for Aneuploidy. So a complicated title, but it's mainly used for women over 37, because as women get older, their egg quality declines, and the number of chromosomes in each of the eggs may be wrong. The chances of that happening in women over 37 increases, and it's called aneuploidy, and that can result in failure of embryo implantation. It can result in miscarriage, it could result in a child affected with an aneuploid condition. So our talented embryologists can remove just a few cells, and this is what the picture on the right here is showing, a few cells of the embryo using a biopsy technique. It's similar micro manipulation equipment that we use on the ICSI that we saw earlier. And we send those few cells off for testing, and we'll get a result back within a couple of weeks. So we freeze the embryo while we wait for the results to come back, and then we choose the ones which have the correct copy number of chromosomes, thaw them and transfer. So again, this improves the chances, reduces the chance of miscarriage, so it improves the chance of us getting the best embryo for transfer sooner. So it's a very exciting and sophisticated and reliable technique for a particular group of patients. So irrespective, I'll move on to embryo transfer now, irrespective of how or which embryo we've chosen, so whether we've used care maps, PGTA, or we've used standard methodology to choose the embryo, we're going to transfer it in exactly the same way. So the embryologist loads the embryo into a soft, fine catheter, and then it's inserted through the vagina, in through the cervix, into the womb, and we use ultrasound guidance, usually, to make sure we're in the right place and release this embryo into the uterus, into the womb. So we have a 2-week wait after that special procedure before we do the pregnancy test. So before you go home after embryo transfer, one of our nurses will explain what happens next. So yeah, this is what they call the 2-week wait. Generally, we'll provide progesterone medication to support implantation during this stage of the treatment. And then the pregnancy test is about 14 to 16 days after the embryo transfer. If it's positive, then we ask you to come back for an ultrasound scan a few weeks later. And if it's negative, then we offer support and counselling advice. And we like to have a follow-up consultation where we can talk through what happened and what you want to do going forward, and when you're ready to discuss the next steps. Just a little bit about donation. So we've got a large donation team and with counselling specialists as well at Care, and with everything in place if you need to use donor eggs, donor sperm or donor embryos. And our donation team have more than 25 years experience, and they've helped more patients start a family than any other UK clinic. So we support you through the whole process, from your initial questions about donation right through to being able to select a donor. So that's an egg donor or a sperm donor for that matter. And I'd like to say a few words now about the support that's available generally that you'll receive from Care. We offer free counselling appointments. We have a Care Buddy programme where we can link you up with other patients and people going through the same sort of treatments at a similar time, if you wish. It's not for everybody, but it is very well received. We hold regular online support group sessions. We have an online forum that you can use to chat with other patients. And this is all alongside the continued support of our care teams, of course. We've also got Care Pay, which we're not just here to support you medically or emotionally, but we are here as well to support financially. So we've developed this Care Pay. It's exclusively individually tailored IVF funding packages, and it's designed to give patients the financial peace of mind of knowing that they've got a plan in place to fund their treatment if they're not fortunate enough to have NHS funding. And so we created this following patient feedback, and it's managed entirely in-house. So patients have a more seamless experience than going to a third party, which is sometimes the case. So we've got 3 programs for Care Pay, and all of them include, I won't go into great details of each of them, but all of them include the cycle monitoring. So one cost includes the monitoring, the egg collection, all the embryology procedures, including the care maps, the time-lapse algorithm that I explained. It includes embryo transfer and only embryo freezing and storage, and unlimited embryo transfers, because some patients have several embryos. We'll transfer one at a time usually, and the rest can be frozen. So it includes all the embryo transfers. So we're going to move on now to our first question and answer session. So just as a reminder, we've got our new patient inquiry team available till 8 o'clock this evening if you want to call them. And if you want to ask any questions, you can use the chat function or the questions tab, or email us at events@carefertility.com. So we'll now minimize this picture, and hopefully by magic, Professor Charles Kingsland will pop up and we can go through some of your questions. I've got some already that were sent in earlier. Here he is. Welcome.
Good evening.
Good
Can
evening.
you hear me?
You're back from your holiday?
I have, yes. I spent a week in southern Italy. It was very pleasant, thank you.
Alison.
lovely.
And I'm now back in the sunny northwest because it's been a lovely day in Liverpool.
Oh, I should have stayed. I've been down in the southwest.
Oh yes, in Bath. I think you'll find that Bath is in Somerset, not Gloucestershire.
Sorry, yeah. But now I'm in Gloucestershire. I'm near Stroud in Gloucestershire now.
Are you sure?
That's why I'm confused. Right, so we've got lots of questions and you are the expert. So I could fire some at you, or have you got one that you already want to go for?
Shall I just go through mine? I've got quite a few here.
Yeah.
I'll have to use my glasses because the writing is quite small. Do you provide any sort of treatment which would make a woman more fertile, i.e. hormone injections? Well, the answer to that is yes, of course we do, because that's what we do. We try to help couples or single individuals wanting to have a family. We offer the full range of treatments that are available. Sometimes that requires hormones, not always, but most of the time we'll be using some hormones, but it also depends on the type of fertility problem that you might have and how quickly we need to resolve it. So the answer to that is yes. I was wondering if it is possible for us to arrange a follow-up appointment to discuss what would happen if we were to proceed with IVF again in the future. I ended up being hospitalized twice with severe OHSS too, so it would be good to speak to a consultant to see if the protocol would be different to avoid this next time. OHSS is one of the very rare side effects of IVF treatment where, and it stands for ovarian hyperstimulation syndrome, where the ovaries unpredictably go overboard and produce a lot of eggs, and that can cause issues with biochemical abnormalities, abdominal pain and bloating, and maybe in severe cases clotting issues. And nowadays most of the time we're able to predict OHSS and prevent it happening by lots of different treatment methods. So my advice to this particular lady would be to, yes, of course we can, you can seek advice. Just phone your local clinic, the clinic where you had your treatment, or one of our clinics, and a consultant will be there to advise you and how to prevent this happening again. And 9 times out of 10, there are methods that can prevent this occurrence happening, because that's what we want to try and avoid. Is there a BMI limit for IUI? Well, BMI stands for body mass index, and that's your weight in kilograms divided by your height in meters squared. Sorry, uninvited guest there. So normally your body mass index is between 20 and should be between 20 and 25. Over 30, we must try and reduce it a little bit. Under 20, you need to try and get your weight up a little bit. So your body mass index is between 20 and 25, because there's no doubt, there's lots of evidence to suggest that if your body mass index is between those two parameters, then your fertility is its highest. So we would say that really a body mass index of over 35 would be a cutoff for intrauterine insemination. Ideally, it should be under 30, but we know some people will have difficulty getting the body mass index at the right level. We can always help with our nutritional programs, but sometimes it's difficult. Over 35, then your chances of achieving a pregnancy with intrauterine insemination does go down, but more importantly, your risks go up. So we try and avoid that. I've had my tubes tied. I am 30 and a smoker. Can I have a baby? Well, the answer to that is yes. If you've had your tubes tied, then we need to bypass them. So the treatment would be IVF. We would strongly advise you to reduce your smoking, because smoking is not good for you. And more importantly, it's not good for the baby. There are numerous studies that have proved unequivocally that smoking is bad for babies, and it can contribute to difficulty achieving a pregnancy. And that's why we advocate you reducing or completely cutting out smoking well before you go for fertility treatment. And in fact, as a general health advice as well, stop smoking. I've been told often that my thyroid was normal, however, it is no longer normal for IVF treatment. I am now on meds. I don't believe I should be. Well, the answer to that is quite simple. You just need it checking, and you need advice regarding your thyroid, because we like to have any thyroid problems tightly controlled, as we would do with diabetes or any other medical condition. The more tightly controlled your condition, the better is your chance of achieving a pregnancy. And therefore, before we would embark on any treatment, we would monitor, we would measure your thyroid hormones, monitor them and get them under control to give you the best chance of having a baby. Can I have some info on egg freezing? Yes, of course you can have information on egg freezing. I'm actually surprised that more people don't ask about egg freezing nowadays, because it's such a successful method of preserving your fertility. So you can have your eggs frozen in your early, mid or late 20s, and then those eggs are frozen in time, so that if you were to decide to delay your family to your late 30s and you were no longer as fertile as you might have been, those eggs can be used and it can be thawed out, and they still have the capacity of a 25-year-old egg. So it's a clever way of preserving your fertility.
Yeah, and we've got some great information on egg freezing, and we've got some great technology as well. We're able to offer artificial intelligence and individualized reports with photographs of each egg before it's frozen and a prediction of its success. So really clever stuff. And I think it just gives you so much more information and helps, it just empowers women to decide what they want to do. So really important stuff. So we've got lots of information, so we'd be happy to share that. Here's a good question, Charles. I'd love to hear what treatment options you can offer for low AMH levels and a history of recurrent miscarriage.
Okay, well, AMH stands for Anti-Mullerian Hormone. It's the hormone that's produced by the little cells surrounding your egg. So the more AMH you've got, the more eggs you've got. It tells you nothing about the quality of your eggs, just the quantity. So if you are 20 years old, it may be better for you to have a low AMH than if you have a high AMH when you're 40 years old, because all that means is you've got a high number of 40-year-old eggs, which may be of lower quality than a lower number of 20-year-old eggs. But what it sounds to me, one of the important factors that I would want to know about this particular lady is how old she is, because that has an important bearing on her outlook and outcome for future pregnancy and a child live birth using her own eggs. So and the fact that you've had recurrent miscarriages, we know that miscarriages are strongly related to aneuploidy, what you were talking about earlier, Alison, where the embryo is genetically abnormal and therefore stands very little chance of being born alive. And that's why the majority of miscarriages happen, because the baby is just not viable and your body recognizes that. Not all cases of miscarriage, but a lot. And that can be linked in with your age and your egg quality. So my advice to you would be seek advice. And at Care, as Alison has mentioned, we have numerous clinics throughout the country, and each one has consultants there who have their own specialty, so we can pool our information and give you the best advice to have a healthy live birth, particularly when you've gone through the trauma and the tragedy of recurrent miscarriages. So seek advice early and hopefully seek advice with us.
Yeah, it's really difficult, isn't it, Charles, to give advice on such little information, but it's hard for these patients asking questions.
Yeah, it is.
A lot of information. It's difficult. So, and I think we were talking before about how we have this broad experienced team. We've also, with that comes a great big toolkit. So for recurrent miscarriage, for example, we have PGTA, which we talked about before. We've also got specialized culture medium in the laboratories that's proven to be beneficial for that. So it depends on the circumstances, but we've got so much experience in different tools that we're able to customise treatments depending on so many different factors.
And I think it's very brave for patients to come on the forum and give this information. But you know, when you've been through those sort of stressful conditions, then seek advice, and we can give it to you. Yeah.
What shall we now just have a quick video, and then we'll come back for some more questions.
Okay.
Thank you. See you soon.
See you soon.
Right. So now I'm going to pop up another video. I like this one very much. Just find the right one. Here we go. So this is Shah. She's our new patient inquiry team leader, and she's going to tell you about how to get started with care. And then Dave, our CEO, comes on to talk a little bit about our ethos.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to care fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of, well, one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and, you know, fingers crossed, will give you that positive result from at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared for by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists, and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, And that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are care.
I hope you enjoyed that. Now we'll invite Professor Kingsland back for a few more questions. There's one here. Oh, here he is. Perfect. Here's a question, Charles. It's a good subject, important subject. Someone was asking, saying they want twins. So this lady's 37 and would like 2 children at an earlier age. Is there any way to improve these odds? What can you tell us about?
It's actually a surprisingly common question, but as an obstetrician and gynecologist, I have to say that the human female is designed to carry 1 baby at a time. 2 at a push, 3 almost never, and 4 is virtually unheard of naturally. The problem with twin pregnancies is that we always see the happy, healthy twins being pushed around the supermarket in double buggies, but we don't see the tremendous problems that some twins will suffer just by being born 2 in the uterus: prematurity, illness, being too small, and all those problems. And the mortality rate of twin pregnancies is much higher than singleton. The other thing is that twin pregnancies are 5 times more likely to miscarry than a singleton pregnancy. So twin pregnancies are fraught with danger, and for that reason nowadays we try and avoid them. Years ago it was difficult with the technology that was available to avoid twins. Nowadays we can to a large extent prevent the problems that twins can bring about, and that's because of our scientific colleagues being able to assess and create much more high quality embryos, so that we can freeze those embryos and deliver a single embryo at a time, so that we have a mantra amongst gynecologists: have as many babies as you like, but preferably 1 at a time. There are occasions when circumstances dictate that we would want to put 2 embryos back. Maybe the embryos are of poorer quality, or a patient has many embryos and has had multiple attempts at IVF and hasn't got pregnant, in which case there are always exceptions. We can put 2 back, but we always have that risk. And when we scan a woman and we diagnose twins, women, couples are usually elated, but for us gynecologists, our hearts tend to sink a bit because we think about the impending dangers. Fortunately, the majority are born healthy and happy, but a significant number are not. So many babies as you like, 1 at a time.
Yeah, that leads on to another question that's just come in. Are there any other risks? So we've talked about the ovarian hyperstimulation syndrome and multiple pregnancy. Are there any other risks with IVF?
IVF is a routine procedure. The risks are minimal. The 2 major risks to IVF have remained the same for the past 40 years, and they are ovarian hyperstimulation syndrome, which we've talked about earlier, where the ovaries respond very vigorously to the hormones and can cause significant biochemical anomalies and then illness. So we try and avoid that. And the other one is pregnancy, which is what we're trying to achieve. But what we want to, the risk of pregnancy far outweighs the risk of of the IVF itself. And that's not the IVF pregnancy, that's any pregnancy. IVF pregnancies are not higher risk, but a pregnancy itself is high risk. And that's why we want to reduce the risk of those problems occurring by being as a good body weight, not smoking, preparing yourself for pregnancy, taking your folic acid, and having one embryo put back at a time. There are lots and lots of bits of advice that a care clinic can give you. And I think it's important and very sensible to think about pre-pregnancy planning. In a lot of times we just take it for granted that pregnancies will be normal and healthy. And fortunately, the majority of them are. But when there's a risk, like the previous girl with thyroid problems, let's address those risks before the pregnancy occurs, so to reduce minimize the risk of pregnancy and of the IVF itself. There are a lot of minor symptoms like bloating, irritability, hot flushes, and they're hormonally derived problems, but they are self-limiting, fortunately. But the major side effect, I would say, about that most women suffer, most couples suffer, is the psychological one. It's very stressful. IVF, you can't get away from the fact that IVF is a very stressful business, and the stress often far outweighs the physical implications of the treatment. So it's always best to get yourself IVF fit before you start, and that might be support from your family, support from your partner, support from our counselling teams, and all our counselling teams are available for our patients, or it may be some independent complementary therapy. But just prepare yourself. Don't move house the week before you go on some exotic holiday. Just prepare yourself, get yourself IVF fit, and then if you're IVF fit, you'll be IVF pregnancy fit.
Nice, yeah. And we do everything we can to minimize any stress. And we do get some patients who seem to sail through it and find it exciting. They're waiting for the news, and everybody's different, but yeah, I'm sure it is. I've not been through it myself, but I have seen plenty of patients going through it. It can be tough.
Yeah. What we also remember, Alison, is that a lot of staff have been through IVF, and a lot of our nursing staff and medical staff have been through, and members of our own family. So it's nowadays most people will know an IVF baby, and almost everybody will know somebody who's been through IVF. So it's the majority. In our clinic in Liverpool, we have a number of staff who've had IVF. So we can imagine, and we've been there ourselves sometime in the past, and hopefully that will provide some sort of reassurance and support whilst you're going through the treatment.
Whoa, sorry.
I thought that was you falling over for a minute. Are you okay?
Sorry. No, I was just scrolling to see the questions because I don't want to try and get through as many. We've not got much time left. So if we could just quickly perhaps talk about advanced maternal age and what we offer. So if we've got women over 40 want to have a baby, often have a history of early miscarriage or recurrent miscarriage, what's the best advice for those people?
Oh, if you're planning a pregnancy over 40, you not only is your chance of conception reduced by virtue of your age, and particularly your egg age in the case of the female, but also other issues have crept in. You may have medical disorders, you may have diabetes, or you might have an age-related medical problem. So again, if you are planning a family at the age of 40, first of all, seek advice early if you haven't managed to get pregnant quickly. But also bear in mind that when you're 40, there are some other problems that may occur: hypertension, diabetes in the pregnancy, thyroid problems. So get advice early, and we can, care for fertility clinics are there to provide that advice as well. It may be that you're not even trying for a baby, and you just want that advice and that reassurance, and we can do a fertility check for you and give you some idea as to whether you might have difficulty getting pregnant. Because one thing you don't want to do is, when you get a little bit older, is to hang around. If you've decided you want a family and you're 40, don't wait 2 years or even a year if you've been unsuccessful. Get advice early, because it might be an age-related problem that you're suffering from, and a care fertility clinic might be able to help you quicker. This idea of, just keep trying and you might be lucky. Well, you know what it's like when you're trying for a baby and you've been trying for 6 or 7 months, and then you start getting a little bit anxious, then it's 9 months. Just because you've not waited 2 years, it doesn't mean to say you can't seek advice, even if it's only reassurance. Get the advice early, and then hopefully any problems can be addressed, and we can help you on your way to getting that family you want.
Perfect. Just have one more question before the final video, and I think this is a good question which would benefit from a general answer, because there's not a huge amount of information. But so this lady, aged 34, with a low AMH, a 1.2, asked, would care have any experience with such cases, with women using their own eggs, and any success stories? So I think the point here is, we talked about before, would care have any experience? Yes, we perform around 10,000 treatment cycles every year with this very large specialized team. So we can always find a colleague who's had experience in all sorts of different situations. We had another message from a woman before with celiac disease and high blood pressure. So all of these things, we do have the depth of knowledge between us to deal with almost anything. But if we just go back to that one with the AMH of 1.2, relatively young woman, 34. So what can we offer for somebody?
Yeah, so the good news is you're 34 and you're seeking advice early, which is the absolute correct thing to do. An AMH of 1.2, I think you said it was, is never a good place to start. We would expect an AMH for a 34-year-old to be round about 15. Now, that doesn't mean to say that you can't have a baby, but the chances of you achieving a pregnancy naturally or with IVF, I have to say, are reduced. Then they wouldn't be as optimistic as we would want. But similarly, I've seen women at the age of 34 who've had babies when they've been given a poor prognosis. But what is key to you continuing on your fertility journey is to get the right advice, so that you can make informed choices as to what you want to do for yourself to give you the best chance. So my advice for you is is to sit down with a consultant and just go through the options. What are the risks? What are the benefits? What are the chances? What are the costs? Put it all on a piece of paper, and then decide what is the best way forward for you.
We have something called DuoStim, where we do a stimulation, which we talked about earlier, followed by another stimulation, and that seems to be really effective in cases such as that.
That's right, and you only need one egg. You only need one.
Perfect. Oh, that's a nice place to pause. So we're getting towards the end now, but we've got a few final words in another video about how you can get in touch with us at Care and learn how to book a consultation should you wish. So I will pop this up. I've done well getting these right ones in the right place. Here we go.
1 in 6 people need help to grow their family. You're not alone. And our Care family will do everything we can to help your dream of family come true. There are over 50,000 care babies in the world today, and behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are care.
Thank you very much. I hope you've enjoyed this evening. Thanks for joining us. Thanks very much, Professor Kingsland. It's been really informative. Please send us your feedback and contact us if you need any further information. Thanks very much. Good night.